I'd just like to thank everybody for being here and also for the opportunity to share some perspectives with you. I know that we are all COVID weary and being together is preferable to Zoom, but we aren't there yet. So I am joining you from my home office in Winnipeg, and I'd like to acknowledge that I am located on Treaty 1 lands, the traditional lands of the Anishinaabe, Cree, Dakota, Lakota, Dene peoples, and the homeland of the Métis Nation. Peggy's addressed some of the key themes, and I've been asked to look at potential action frameworks that could help to move us forward, and also to explore some of the challenges that we face. And we do face some challenges, hence my theme of navigating between the rock and the hard place, but navigating, not stuck, because there are opportunities for movement, like the movement of the water that you can see from the picture on my slide. That's PHOA Falls, which is in northern Manitoba. It's about 75 kilometers south of Thompson on the Grass River. The water drops 13 meters, about 45 feet, between prominent rock outcroppings on each side of the falls, rocks and hard places. The falls are remote and stunning, so don't miss an opportunity to view them if you are in their neighborhood. Next slide, Diane, please. So the World Health Organization has made, I think, a valuable contribution to how we think about health and aging and how and where we should invest in our future. Their first ever world report on aging and health, released in 2015, looks in detail at what we know about health and aging, and it offers a framework for comprehensive public health action with a focus on functional ability. A year later, the Global Strategy on Action Plan was endorsed, and that led to the UN Decade of Healthy Aging, 2021 to 2030. And that decade is designed to improve the lives of older people, their families, and the communities in which they live. Interestingly, the WHO's vision for improving the lives of older people and their communities was initiated 10 years earlier through their Age-Friendly Cities and Communities movement, currently with thousands of communities in more than 40 countries. And lastly, let me just reference another current related framework for action, the WHO Global Report on Ageism. So what are some of the key takeaways from their work? Well, the WHO notes that our health in our older age is not random. Some of the diversity we see reflects our genetic inheritance, but most is due to the ongoing interactions we have within the community in which we live. But just as a quick aside, don't dismiss genetics. My wife's family, her dad grew up with 7 sisters. 4 of them lived into their 90s, while Eileen lived to 105 and Jean to 107. And then there's mine. A few months ago, she recounted to our family her recollections of the Spanish flu. Her mom's direction to place a few drops of oil of eucalyptus on her handkerchief, hold it over her nose and mouth as she walked past the homes of people with the flu. Pandemic science has come a long way since 1918. Last week, Mime celebrated her 111th birthday, and she's now the 7th oldest person in Canada. So apparently oil of eucalyptus works. Anyway, the WHO defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. Functional ability, put more simply, the ability to function, comprises 3 elements: the person's place, and the interactions between the person and their place, their community. The person's characterized by the composite of all the physical and mental capacities that one can draw on at any point in time, intrinsic capacity. The person's place provides a range of both resources, but also barriers. So the interactions between the person and their place impact one's ability to do the things that they feel are important. So our ability to age well, to function and to do what we need and want to do is shaped by the person we are and by the interactions with the places we live. I want to just share a story about Elijah. Elijah and I became friends in 1970. He was 21, I was 17. We were both finishing grade 12 in Winnipeg. We lived on the same street and often walked to school together. I had lived on that same street all my life. Elijah had already lived in residential schools in Norway House, Brandon, Birtle, and Garden Hill. So 10 years later, I was living in Thompson. I was working with the province with fitness, recreation, and sport. I flew into Red Sucker Lake to meet with the chief and council. Well, don't you know, Elijah is the newly elected chief, his home community. So we had some great discussions about how we could build and collaborate a stronger, more healthy community, perhaps a recreation director, community facilities, resource materials. Well, Elijah went on to become a provincial cabinet minister in the late 80s, and later as an opposition MLA, holding his eagle feather, he rejected the Meech Lake Accord, bringing down a constitutional amendment package and changing the shape of Canada, because these settler people and their governments don't recognize us as a nation, as a government, and that is why we opposed the Meech Lake Accord. So my friend Elijah continued in politics. They made a movie about his life, but Elijah also had struggles, addictions, and health issues. And in 2013, at just 64 years of age, he passed away in Ottawa, and he's buried back in Red Sucker Lake. So all of that to say that we all experience a range of person-place interactions. We all age differently. So the person part, Elijah was a friend, amazing person, fascinating life, but his inner strength, that intrinsic capacity to navigate residential schools, become chief of Red Sucker Lake, a provincial cabinet minister, later went on to become a member of parliament, saying no to Meech Lake. And then the place part, we grew older in different ways. The places we lived were sometimes the same or similar, Winnipeg, Ottawa, but often very different, Red Sucker Lake and Thompson. So now as I meet people, I wonder about their person-place interactions over time, but also now. What are the resources in their community that are helping them? And what are the barriers that challenge them? So the next slide, please. So the WHO, through the Decade Initiative, is asking us to build an age-friendly world, to address ageism, and to transform health systems away from disease-based curative models towards integrated person-centered care. So let's talk about some of the rocks and the hard places. Building an age-friendly world that facilitates person-place interactions that support that functional ability. The AFC model comprises 8 domains in a unique framework that combines the social environment, the person part, with the built environment, the place part. So from the person perspective, domains like respect and social inclusion, communication and information, community support, and health services. And the place part, outdoor spaces and buildings, housing, transportation. But I think what's most unique about the model is the integration of person and place, of the social environment and the built environment. So housing that accounts for social participation, transportation that gets you where you need to go, outdoor spaces that are safe, sidewalks and signal lights, and spaces that bring people together, parks and friendship centers. As I noted earlier, it's a global movement, and Canada has been a leader. And while all communities are age-friendly, many have not started the journey to become more age-friendly. So second rock, WHO suggests we need to shift our focus from disease management to functional ability. We need to reframe our thinking about care systems. I'm just going to ask you to bear with me. Close your eyes, picture the hospital in your community or the one in your neighborhood. With eyes still closed, picture the community in which you live, the hospital, but then move around, your favorite park, the local Y or fitness center, the library, the senior center. Now ask yourself, where does my health come from? If you answer to both, you're probably correct. And I know that's a simplistic view, but my point is that we need to balance our thinking and our public policy debates. While we all want the best illness care system we can have, the healthcare system accounts for only 25% of health outcomes, regardless of the levels of funding. Yet we continue to give short shrift in terms of both resources and value to the community systems that we all use to build our health. Tom Carson, a good friend of mine, a unique perspective. He was the Deputy Minister in Manitoba of Health for a number of years. He was also the Deputy Minister of Culture, Heritage, and Recreation. So both really important systems. And his perspective was we just need to keep breaking down the silos and ultimately give people that sense of control that we all want. So final point here, we live in a federated, very large and multi-layered country. Canada is often not easy to navigate or sometimes understand. Federally, we have Health Canada, as well as the Public Health Agency, along with health ministries in each of our 13 provinces and territories. So the Canada Health Act allocates responsibilities. The federal government disperses money. Is it enough money? Is it all spent on the intended purposes? Does it get the intended results? How does that money complement the money already brought to the table by each provincial territorial government. And then we have municipal government, key provider of health promotion programs and services, recreation, libraries, parks, housing, transportation. They're key to developing those more age-friendly places. And then we see Indigenous governments, and more their institutions emerging at the community, provincial, and national levels. Dr. Mike Rutledge made a really valuable contribution to our Chapter 4. And after a five-year term as the Chief Provincial Public Health Officer in Manitoba, he's now working as a medical advisor with a new organization created by the Northern Chiefs organization and designed to achieve health and wellness services that are reflective of the needs and priorities of First Nations people in Manitoba's north. And then, equally importantly, we bring in civil society, individuals and organizations that make invaluable contributions to both illness care and health care. Many are national level organizations, many of those have organizations at the provincial territorial level. And of course, there are many organizations that function just within their own province or community. So the last slide, and the one final challenge that I see, navigating our way forward. So I believe the World Report lays a foundation and the decade provides a focus. Pleased that the Public Health Agency is leading our decade efforts in Canada. And as just outlined, we have a lot of moving parts, vision and leadership from governments. So a national housing strategy, it's a single focus, build housing. SHIFT, Nova Scotia's action plan for an aging population. It was developed a few years ago, but it was comprehensive and, in my opinion, a wonderful framework. And then vision and leadership from civil society, the Alzheimer's Society leadership in the dementia strategy for Canada, Saskatchewan Seniors Mechanisms, passion for a provincial strategy on positive aging. And I would not want to lose any of these efforts or ones like them to the notion of a national seniors strategy. Rather, I would propose a national framework on aging, built on the one that was written in 1994, a national framework on aging that brings an intergenerational perspective. Aging, not the word seniors, is inclusive of all existing and potential future policies and strategies of governments and civil society. One that resonates with the voices of older Canadians of all ages. Engages community, bringing a bottom-up and top-down process, brings better balance to our care systems, and which gives us a shared vision in which all of us can see ourselves. Yes, complicated like a Rubik's Cube, but perhaps as simple as Canada, the world's most age-friendly country. Thank you. I'll turn it over to Sherry and Diane.